Hey, good optometry morning. Dr. Michael Nelson here, your YouTube eye doctor, but today I am not the doctor. Today I am the patient, so I'm standing here in downtown Winnipeg, and in a few minutes I'm going to be getting an intravitreal injection into my right eye to treat cystoid macular edema. So the medication that the retina specialist is going to be injecting today is called Ozurdex. Ozurdex is a time-released pellet that's injected into my vitreous, and it will release the steroid dexamethasone over about a 3-month period. And so what we're treating today is cystoid macular edema that has developed due to posterior uveitis caused by birdshot retinopathy. So that's a mouthful, but stay tuned because we're going to give you before and after OCT images of my retina as it resolves, and I'm pretty excited because I've had these injections before and they usually resolve pretty quickly. So stay tuned and make sure you hit the subscribe and the bell button so you get more notifications for videos just like this one. All right, so we're going to be talking about macular edema today, but I'm not going to be spending a lot of time telling you what macular edema is or what the specific treatments are for macular edema. If you're looking for information on that, I've got another video that you can look at right up here. But today I'm going to be talking to you about a specific case of macular edema, and we're going to be looking at how it was treated and then looking at the resolution of the macular edema over a few week period. All right, so like I said before, macular edema can occur for different reasons. And this case we're going to be looking at today is a case with my eye, and it involves a posterior uveitis macular edema. And specifically, it's related to a condition called birdshot retinopathy. Now, it's not unusual for macular edema that develops because of posterior uveitis to require a corticosteroid to get it to resolve. And it often requires that corticosteroid to be injected right into the eye, into the vitreous inside the eye. And that's what we're going to be looking at today. And so the steroid that was used on my eye was an intravitreal steroid called Ozurdex that's injected into the vitreous. All right, so what is Ozurdex? Ozurdex is a small rod-shaped implant that's injected right into the vitreous, and then it slowly dissolves and releases about 700 micrograms of the corticosteroid dexamethasone over about a 6-month period. And it releases its highest concentration at about 2 months, followed by a lower dose for up to about 6 months. And this implant completely dissolves, so there's no need for any procedure to remove it. So now if you are like me, I was a little anxious before my first Ozurdex injection, and I was a little hesitant about putting the animation of that injection of the Ozurdex in this video for fear that it might make you nervous as well, because in that animation it really makes the needle look huge. But let me reassure you, it really is not bad at all. The injection only takes about 5 minutes. The retina surgeons do these regularly. They do them all the time, so they have lots of experience doing them, and you do not feel anything more than a little bit of pressure on your eye. And the implant itself, it's about 0.46 millimeters in diameter, and it's about 6 millimeters long. Okay, so the other cool thing is that you can kind of see this implant because it can be located anywhere in the vitreous, and as a patient you can easily see this kind of rod-shaped floater sloshing around in your vision, the shadow. And the eye doctor, when they see you, they're going to be able to see this implant when they look inside your eye. And it's even possible to be able to see this with the naked eye, especially if the pupil is dilated. And so, for example, in this video here that you're watching, this is a video of the Ozurdex implant inside my eye. And it's pretty cool when you can see that little implant sloshing around inside your eye. All right, so when you visit your eye doctor, they may be able to see the macular edema just by looking inside your eye with a microscope and a lens. However, oftentimes that macular edema is so subtle, we need some more sophisticated technology to view that macular edema. And the type of technology that we use is something called an OCT, which stands for optical coherence tomography. So when I say OCT, I want you to think of it as a high definition ultrasound, but instead of using sound waves to measure the tissue, it uses light waves. And this gives us a 3D cross section of the macula in the retina. So the macula of the retina is a specific portion of the retina, and I've talked about this before. The retina basically is like the film of the camera or the sensor of the camera inside the eye, but there's a specific area of the retina called the macula, and the macula deals with your central vision, and it deals with about your central 10 degrees of vision. That's kind of about that much area of your vision, and that's where your really best vision and really clearest vision is. So the OCT is really the best tool to help us image and give us a cross-section of that macula. So let's take a look at some of these images. So when we image the macula with an OCT, we will get a normal image kind of like this. And this is basically a cross section of the macula. And so this top part of the image, this is the innermost side of the eyeball, and this is where the vitreous is. And these colored lines show different layers of the retina. And if we look at these specific bright orange areas, these are the layers of the receptor cells, which are the rods and cones which you may have heard of before. So in the very center of the macula, there's an area called the fovea, and that's where your really, really detailed vision is. And that's where we have this normal dip or valley in the macula. And this is because this area needs really detailed vision, and it doesn't have all the layers of neurons or nerve fibers that are sitting on top of the receptor cells. So this is a normal, healthy-looking OCT picture of the macula. So if you see a picture like this at your eye doctor's office, this is called an OCT. Now sometimes the picture will be in color, but more often we will look at this image in black and white because it'll give us a little bit better resolution than the color version will. And so when we talk about macular edema, this area of the fovea starts to build up fluid, and you'll get little pockets or cysts of fluid that develop in this foveal area and start to elevate and cause this tissue to swell. So the normal thickness of the macula, and in this picture here, the macula is about 250 microns thick. That's 0.25 millimeters thick. This particular image here is an image of my eye before I had some treatments for the macular edema. All right, so let's talk about this image here. So this has a side-by-side image of some OCT. So on the left-hand side is the image of my eye, and you can see these pockets of cysts from the cystoid macular edema right in the macula. I don't have that classic indentation where the normal retina would be. Now on the right-hand side is another way to view the OCT. And what this one does, this gives us a cross-section in the horizontal and the vertical plane. There's one cross-section these lines indicate here. Then we've got a couple of different maps down in the bottom right corner. This gives us kind of a topographical type of map where colors indicate how thick the retina is and how much it's veering off from normal. So when it's up in the orange and red range, that means it's going to be thicker than normal. If it's down in the blue range, that means it's going to be thinner than normal. And the normal thickness is right in this green zone. And you recall I said the normal thickness of the macula is at about 250 microns. So we would expect this all normally to be green, but here it's red because it's thickened. Now, if we look at the top map, it gives us by quadrants, and it averages out how thick in microns the retina is. And what I want you to do is watch this center one, because this is where the central vision is, and you'll see it says 420. And so before treatment, this is the day of the treatment, the morning before treatment, my macula was 420 microns rather than the 250 microns. So let's just see how this progresses through. So here's the day of the injection. This is the image you just saw. You'll see 420 microns. This is day one. So I've had the injection the day before, and then I took an OCT image, and you'll see that the macula is already starting to reduce in its thickness. So we go to day two. The macula has reduced even a little bit more in the thickness. So that is, you're getting improvement and reduction in that cystoid macular edema even in day one and day two. So we're already down to 322 microns. And this is interesting. This is day three. And you might notice that this is actually thicker than it was the previous day. And sometimes that can happen. You can have a wax and waning of the cystoid macular edema. That fluid can shift around and move around as it's resolving. And so you might get some thickening one day and maybe thinning the other day. But generally, what you want to be looking at is the general trend. So here we've got day 5, and we're down to 309 microns. I noticed an improvement in my vision probably at day 2. There was probably a little bit of an improvement day 1, but definitely day 2 and day 3, I was definitely noticing an improvement in the quality of the vision, less reduction in the contrast, and then also the visual acuity was improving. So this is day 5, almost a week. So day 6, we're down even a little bit thinner. Day 7, you'll see that it jumped up a little bit thicker again. This is day 8. Here we are, day 9. It's kind of hovering at this point at about 310 microns. Here's day 11. So this is not quite 2 weeks, but you'll see that there's a reduction to a little bit more. And you'll notice that this topographical map, it's turning more green and not quite as red. You'll still see there's a couple of pockets of cysts of fluid, but it is definitely resolving. So here we go, day 12. Day 17, this is a little bit more than 2 weeks out. Here we are, this is day 45 after the treatment. And you'll see by this point, the macula is 252 microns. So this is definitely reduced down to the normal thickness, and visual acuity and function is really come back to normal at the day 45 point. And here we are at day 57, almost 2 months out after the injection, and the macula is still in that normal range. So we definitely get, and here we are at, 2 months, a little bit more than 2 months. So this image here, this one here is showing before image, before treatment. We have all these pockets of fluid and the cystoid macular edema, and then here's after treatment. You can see definitely the macula has come back into the normal thickness and the normal appearance, and vision has resolved. So I'm really excited about how Ozurdex works and how quickly it works, by noticing that you're getting improvement in the visual acuity and the quality of the vision within a week is really great news for patients that are having this. And then the fact that it retains that improved vision, and you get that added effect of that time-released dexamethasone is a really great plus to Ozurdex. Okay, so I've had a number of Ozurdex injections in my eye, and overall I've been quite happy with the results of these injections. Now, my injections, they've ranged in the length of time that I've spaced out between them. I've had them as frequent as every 3 months, but sometimes they've been spaced out, a year and a half or 2 years apart. And so that's the great thing about Ozurdex for me. I like that time release of the steroid over time, so I don't have to go for as many injections and as often as I would if this wasn't time released. So, all right, so if you've learned anything new in this video, make sure you hit the like button down below so you can tell YouTube the value of this video. And with that, have a great optometry day.